Yeah. Okay, so before proceeding with this session, I would like to thank the organizing committee for allowing me in this such conclave and providing some of the inputs about the particular topic. Number two, I would like to give an acknowledgement for the first speaker, Dr. Abhijit Sir, and the second, Dr. Sumit, for enlightening a lot of points, which currently it is a booming with the pros and cons of basically whether the self-medication can be an effective tool or whether it can hamper the discipline of the prescriptions. Okay, you may please change the slide, sir. Okay, so we have gone with this definition previously as explained by Dr. Abhijit sir. Let us have again a brief understanding about it. The taking of drugs, herbs, or home remedies on one's own initiative or on the advice of another person without consulting a doctor. So this itself indicates that there is a belief in the system that you are being able to cope up with your own self rather than consulting the physicians. Family, friends, neighbors, the pharmacist, previous prescribed drugs or suggestions from an advertisement in newspaper or popular magazines, WhatsApp, Facebook, etc. All of these OTC sources are common sources of self-medications. What happens is, basically when you go into a process of symptoms in a particular illness, there is a first trigger sector in the mind that you have to get sick out of it at the earliest. As rightly said initially, that the economy is one. Another comes up with the burden of the duration of the treatment. How do people come up with this conclusion? Number one are the environment around us. We, as a human being, are very much intact with the contagious thinking. We always start to have a conversation with various people, asking about them, what was the previous treatment given for you, the same or not? Change the slide, sir. Purpose behind self-medication. So it is the attitude I would like to brief about. Desire and ability of people, patients to play an intelligent, independent, and informed role, not merely in terms of decision-making, but also in the management of those preventive, diagnostic, and therapeutic activities which concern them. Although responsible self-medication helps to reduce the cost of treatment, traveling time, as well as doctor's time, consultancy time, but it will definitely land you somewhere or the other in an adverse situation. For framing this concept, I think so we all are aware about the classification of the COVID symptoms. We have the asymptomatic group, we have the mild, we have the moderate, and we have the severe. The taste and the diagnostic criteria, as per claimed by the ICMR, the Ministry of Health and Family Welfare, itself indicates that the incubation period of the infection always matter with the viral load combating with the immunity. There are a lot of biomarkers in the current scenarios wherein a lot of people are going with the investigations, even in their temperature or even they don't have a prominent symptoms as explained or claimed by the Ministry of Health and Family Welfare. Please go ahead, sir, with the next slide. Yeah. So in a COVID-19 situation, perspective of self-medication. The self-medication concept traditionally was inbuilt, but over the time, as there has been a lot of e-platforms available and easily accessible for the end users, this has made currently a havoc in the market as well as for the industry purposes and also for the consultant for taking a decision for the counteracting the previous treatments. Statistics of infection, mortality rate, recovery rate is an information which is provided by media, e-platforms based on experts' comments. For my first statement, I would like to inform you all that even today, when I try to go on my YouTube, when I try to go into a particular news channel, what do we see? We first see the rate of recovery in the COVID times. Another thing, we go with the rate of mortality. And another is the rate of the incubation period, which is increasing in this country. For trolling this media and the myths, what exactly has happened is this has created a fear unnoticingly. Even the statistics is just for providing a confidence for the community that over the time the situations are going to come or slow down. But due to unintellectual understanding, or you can say anecdotal evidences, the people are just trolling unnecessary evidences through their mediums. Fear and panic situation leading to self-belief and rumors of unethical practice for profit businesses becomes a challenge for community to explode with right medication at the right time of diagnosis and its clinical feature. As said earlier, that if in excess the fever doesn't get set up within the upcoming 3 days, definitely you would be requiring for a particular a biomarker test or a particular specific epidemic outcome test. Unnecessary doing a test can increase a burden over the testing center also, and also can reduce the significance of the results if not given at the right time. As earlier said, asymptomatic, mild, moderate, and severe cases, issue of self-medication persists. How? We will come into the further slides. Now, what had exactly happened in this scenario of self-medication is, I would like to share you some of my few inputs when I was working in some of the COVID care centers, some of the various dedicated COVID hospitals, and also when I had a meeting with one of the famous epidemiologists of the Indian ICMR, Dr. Ramnagat sir. We first encountered various medications which were enrolled and which were rampantly used in the phase 1 trials and also in the community level. First comes the antipyretic paracetamol, as rightly said, with the brand name of Dolo 650, or you can go into Crocin. Another comes up with the antiparasitic, that is ivermectin. Then comes up with the antibiotic. We have azithromycin and doxycyclines. Fourth, we have the steroids, methylprednisol and dexamethasone. Fifth, we have the antiviral, as rightly said by the first speaker, that is remdesivir. And then coming up with the second largest part of the system, that is the Ayush medications. Speaking with the antipyretics, I would like to give you some brief outcomes. Antipyretics, most of them are being easily accessible over the counter also, and without the prescriptions also. What had happened is rampantly use of these paracetamol drugs can lead to an hepatic damage with the cytokine potency to your liver cells. If the dose extends up, definitely the fever doesn't comes down, then definitely you have to consult your physician as to see whether what is triggering for the second infective conditions. Number 2, we have the antiparasitic ivermectin. To bring you a brief about ivermectin, I would like to emphasize you on March 2020 situation. What had happened in India, it was December 2019, it was claimed by various journals in medical field. The Lancet is the reputed one which tries to give us a forecast about what was the first clinical features coming up out of these epidemics. At that time, there were a lot of repurposing of the drugs coming up into the market. The time when there was no any vaccine available. Number 2, there was a time when we were understanding the pathology of these conditions. And third, we were understanding the community behavior. In such conditions, ivermectin with a test group, with a control, had shown a lot of results in a mild and asymptomatic groups. Over the time, the advisory from the Ministry of Health and Family Welfare thought of putting this drug into its committee and be regulated in its district as well as community centers for the mentioning of the control of this epidemic. Thirdly, antibiotic. We rampantly see in our first advisory, the use of azithromycin was advised. The use of azithromycin, even the kits were given in the various centers. Secondly, in the resistance of this azithromycin, various of the physicians, they came up with the prescriptions of the doxycycline. Now here, when it comes towards India, there are the statistics, a lot of statistics coming up in the market that about the role of the physicians. Number 1, the ratio of the patient as to physicians, wherein we have identified that various of the antibiotic policies specific to the Indian country that has not been rampantly followed. What matters is if you are not following the antibiotic policies over the time, the same antibiotic can become a resistance for the particular conditions. Understanding the fourth perspective of the steroids, methylprednisolone and dexamethasone. Definitely steroids have been always been a life changer when there are a cytokine storm generating into the system, another with the immune suppression conditions. But if excessively used, these steroids, it can hamper the immune systems. Ultimately, what currently are we seeing is the mucormycosis, the conditions of the fungal which is coming up, which ultimately is triggering a lot of patients. Wherein for the controlling of this mucormycosis, we have the amphotericin B, currently the treatment, and even there are studies going on as to see the comparative analysis of the first treated COVID patients and with the second wave of the COVID patients. Do they have the same demographic changes with the line of treatment, or do we have another line of treatment coming up over the market? Fifth, as rightly said by the speakers ahead, remdesivir has really become a concern of use because if you try to understand Glenmark and various pharma companies, when remdesivir wanted to be enrolled into the emergency units, it was first gone with previous Ebola outbreak events, number one. Number two, the efficacy in the phase 1 trials, wherein it was confirmed that it might show an activity. But when the data was extrapolated, it became a little bit of havoc as to what days the same medication should be introduced. This brings up against a question for the pharmacovigilance of the country, that the use and the black market of the remdesivir, which is currently going on, is a really big question of using it with ethics or not. Finally, coming towards the system of Ayush, in India, when you're trying to understand the system of self-medication, we have the two perspectives for relying the information. Number one comes up with the Ministry of Health and Family Welfare, wherein all the modern and conventional treatment comes up into it. Another setup, we have Ministry of Ayush, which runs up with 5 of these practitioners, that is Ayurveda, Yoga, Unani, Siddha, and Homeopathy. I hope so we all are acclaimed of the coronal tablet issue, what had happened. In the April and June, basically, the Patanjali pharmaceutical industries, they came up rampantly that the Ayush has brought up with the issue of the coronal tablet, that they can bring this epidemic to the control. But when there was an advisory put forth by this ICMR as to provide the details of the coronal tablet, details of number one, the efficacy, number two, which patients were treated, number three, duration of treatment, number four, dependency of the oxygen saturations, and number five, the use of conventional medicine superior with the Ayush. At such times, the claims which were made directly on the media bring a lot of havoc in the market. There was, I still remember, a lot of demand for this coronal tablet. But remember one thing, when you're trying to bring such demand in the market, it is going to really hamper a lot for the community. If the drug is not tested for its efficacy and safety assessment, definitely it's going to hamper a lot. Secondly, currently booming issue comes up with the Aspedospoma mother tincture. I hope so a lot of you have got the videos turning in the market. The Aspedospoma has been claimed by various physicians out there that it can increase the saturation, even not going with the proning positions. So claiming such claims, it becomes a difficult part. Why? Because as per the conditions in the COVID, there is a condition of hypoxia, wherein there is a normal respiratory rate, but the downstreaments of the oxygen saturations. Such claims can really hamper a lot for the physicians, definitely can ethicals also, and another for the community. If the drug doesn't show such efficacy, definitely it is going to boomerang for the community, number two, for the physicians, and number three, for the health sector. So please for the last slide. Before concluding my sessions, I would like to give you the first take-home messages. Please consult your physicians for the medications. If you are taking any Ayush medications, a certified Ayush physician should be vigilant enough to understand the health conditions, number two, diagnostic parameters, and number three, with the prescription line. Number two, consulting with the modern physicians. I hope we have the first panelist, second panelist about from them, where you have got the glimpse about it. Number two, prescriptions of the over-the-counter drugs need to be overlooked based on the symptom severity. A lot of people are giving some of the claims over the OTC. So that brings up again other sessions. And number three, don't perceive media information as the Wikipedia for your medications. as it can trigger secondary complications in your health. Currently, excessive use of steroids deteriorates glucose pathway. I think so we all are all well aware. Steroids methylprednisol can reduce the viral or cytokine storm, but ultimately it beats up the beta pancreas, raising the glucose, wherein insulin again coming part. This becomes a lot of a big chain for the market again to reduce the mortality and increases the cost of the drugs. Another thing comes up, the immunosuppressive conditions. Excessive use of steroids definitely will hamper your immune systems. Naturally occurring immunity won't be able to attract in the upcoming times. I hope so with this my landmarks and my remarks, all the viewers and the readers and about the organizing committee would get the message what I am trying to emphasize about it. Thank you so much for inviting me for this session. Thank you, Lord.
Thank you, sir, for indicating the diverse perspectives of internet medication. Thank you so much for your valuable time and giving us a brief explanation of how diverse it could be, the internet medication, because I think there was a haywalk of remdesivir going on in the last 2-3 months.
Yeah.
Thank you for clearing out that to our audiences. Thank you, sir.
Thank you so
A
much.
short break. Yes. Now we would present a certificate to Dr. Aditya Patil. Thank you so much for your. Thank you so much for participating, sir.
Yeah.
Before we move on to the next session, I have a small announcement, exciting announcement yet again for you all. As we know, mental health is very important, and because these days when we're sitting at our homes, everybody is just worked up and don't know what exactly to do. But people who have work, they're busy in their jobs, but what about the others who are just sitting home and doing nothing, because our schools, colleges, everything is running online. So here is a very good opportunity for everyone to participate in the mental health contest, because somebody has rightly quoted, a healthy mind is the greatest treasure to find. And mental illness affects nearly 19% of the adult population, 46% of the teenagers, and 13% of children each year. People are struggling with their mental health, be it in your family, your life next door, be it your children,